day to the lecturer. Today our group 2A will be presenting home medication review case. AB, 62 years old, male, BMI is 30.8, Malay, married. Past medical history is hypertension, dyslipidemia and diabetes mellitus. Past medication history is metoprolol tartrate 100 mg BD, hydrochlorothiazide 25 mg in the morning, amlodipine 10 mg in the morning, simvastatin 10 mg in the night, potassium chloride 600 mg OD, perindopril 4 mg OD, metformin 500 mg, patient is taking 250 mg BD.
For the possible drug-related problem and evidence, we noticed an inappropriate dose of metformin in this patient. Based on clinical practice guideline management of type 2 diabetes mellitus, means and micromedex, the initial dose of metformin should be 500 mg OD or BD. Hence, for this patient, we would suggest metformin 500 mg BD to achieve his targeted fasting blood sugar level. Next, from the interview, we noticed that the patient did not know about the dose of his medication even after second visit. It is important to know how many tablets that he should take daily. Hence, as the intervention, we would suggest the use of pill box in this patient.
For the third DRP we identify is the metoprolol dose may be insufficient. Therefore, we suggest to increase from 100 mg BD to 150 mg BD for metoprolol. For the evidence, based on CPG, Management of Hypertension and Lexicon Drug Info, metoprolol is initiated at 50 mg BD and we can raise the dosage quickly until the desired effect, not exceeding 200 mg BD. Fourth would be the risk of hyperkalemia as patients use ACE inhibitor and potassium supplement at the same time. Based on CPG and micromedex, ACE inhibitor can lead to the potassium retention due to decreased aldosterone production, and this can be worsened with increased potassium intake. Therefore, serum creatinine and potassium should be checked before initiation and within 2 weeks after starting of ACE inhibitor for this patient.
Next, we will look into intervention plans. Dietary modification. Increase diet in fruits and vegetables. Reduce consumption of salt and sugar in diet. Reduce fried and fatty food. For lifestyle modification, increase physical activity, for example, exercise at least 150 minutes per week. Weight reduction is crucial since this patient is obese. The next intervention is patient education. Provide information about hypertension, type 2 diabetes mellitus, and dyslipidemia. Educate patient on the name of each medication and its indication. Increase patient's knowledge and understanding about his current condition. Provide information about consequences of non-adherence. Advise patient to take his medication as soon as he remembers. Suggest patient to monitor his blood pressure and blood glucose frequently. Suggest pusat zakat for financial help if patient cannot afford to buy blood pressure monitor and blood glucose meter. The next intervention is provide referral letter to physician. Since the blood pressure and blood glucose of this patient still uncontrolled even though patient is adhere to his medication. For solution, provide referral letter to the physician. Suggestion for blood pressure to increase dose of metoprolol to 150 mg. For blood glucose, to increase dose of metformin to 500 mg BD. The next is introductions of medication reminder chart and pill box organizer. Medication reminder chart is to ease patient to know when to take his medication, and pill box organizer to increase patient adherence and to avoid medication error. Now we move on to examples of pamphlet that can be used to improve patient knowledge on health and medication. The first pamphlet is hypertension. The second pamphlet is dyslipidemia. The third pamphlet is diabetes. The word used in this pamphlet is easy for patient to understand. This is medication reminder chart that we prepared for this patient. On the left is the list of medications and supplements that he has to take. The timing to take medication, we illustrate it into diagrams on the top of the table. The first from left shows he need to take his medication in the morning, followed by in the afternoon, in the evening, and during bedtime. The capsule diagram indicates he need to take 1 tablet, while 1/2 diagram he need to take the half of the tablet. The icon of plate and utensil shows that he has to take the medication after meal, while icon of plate and utensil with cross shows that he has to take medication before meal. For example, simvastatin is for hypercholesterolemia and should be taken during bedtime and after meal.
The intervention method that we will choose for this patient is pill box or pill organizer. This is to avoid confusion of medication as he is on polypharmacy. And the product that we will show in this presentation is about how to fill in the medication in the pill box and how to cut the medication by using the pill cutter. This is the medication that patients are currently on. This patient is on polypharmacy as he is taking 7 medication for his medical illness such as hypertension, diabetes mellitus, and dyslipidemia. For example, this patient is given 500 mg tablet. The patients need to take 250 mg tablet of metformin twice daily. Therefore, the tablet need to be cut into half by using the pill cutter. After that, the medication can be put into the pill box. The medication that need to be taken after the breakfast need to be put in one compartment of the pill box. The example of medications that need to be taken after breakfast is metformin, amlodipine, hydrochlorothiazide, and potassium chloride. The medication that should be taken before bedtime is simvastatin and it should be put in the night compartment, and simvastatin is used for dyslipidemia. The reason why we suggest to use this pill box is because to avoid any confusion of medication. The example of pill box that we suggest for this patient is weekly pill box.
Moving on to the monitoring plan. For hypertension, regular monitoring of BP level can be advised to the patient either at home or any nearest community pharmacy. And the BP target level can be below 140 per 80 mm mercury because of his age and other comorbidities. Symptoms of hypertension such as SOB and chest pain need to be monitored because alleviation of these symptoms can indicate the effectiveness of the medication. For the safety part, symptoms of hypotension like fatigue and dizziness need to be monitored because of antihypertensive drugs can lead to hypotensive symptoms and can be dangerous. As this patient also receives ACE inhibitor, the patient need to also monitor the dry cough symptoms that can come with consumption of perindopril. Next is for the dyslipidemia. Lipid profiles such as HDL, LDL, and TG level can be monitored to assess the efficacy of the anti-dyslipidemic agent. For the safety part, this patient is at increased risk of getting myopathy because of co-administration of simvastatin and amlodipine. Therefore, early monitoring of myopathic symptoms such as muscle pain, stiffness, and cramp might be beneficial to prevent further complications. For diabetes, regular monitoring of PG level with target free blood glucose below 5.6 millimole per liter is advised in this patient. Symptoms of hyperglycemia such as headache, blurred vision need to be monitored as alleviation of these symptoms can show that the medication is effective. For safety part, hypoglycemic symptoms such as shakiness, tremble, and fatigue need to be monitored, and fast treatment for hypoglycemia need to be performed if this happen. Example include administer 3 teaspoons of honey or sugar, eat biscuits or sweets. As this patient receives metformin, monitoring side effects of this medication such as diarrhea and stomach ache is essential, and this can be prevented by taking this medication with food.
And with that, thank you.